Huh? Heart rate is 208. Why is that? Why heart rate is 208? Can you see P wave? QRS? T is taller than the R wave. So actual heart rate is 104. The machine is calculating both QRS and T and telling the heart rate is 208. So you should not blindly believe the machine. So you should go and palpate and count the pulse rate. So actual heart rate is 104. Okay, thank you.
3 AVF. So what are the 2, 3 AVF? Which wall of the heart? Inferior wall. So 2, 3 AVF denote the inferior wall of heart, and also there is ST depression in leads V3 to V6. So there is ST depression in leads 2, 3 AVF and V3 to V6. So this suggests ischemia in infralateral leads. So this is an ECG of unstable angina or non-ST elevation. So always you have to compare the ST elevation and ST depression with respect to the baseline. So you can take either of them as a baseline. Either this is the T wave, this is the P wave, and this is the QRS complex. So if you see here, this is the P wave, this is the QRS complex, this is the T wave. So this is your baseline. So this is the TP segment, this is PR segment. So you can take either of them as baseline. So when you compare with the baseline, you can definitely see, if you draw a line from here to here, you can make out that this is below this line. So this is ST depression. If this segment, this is QRS and this is the T. So if this is the S wave, this is the S wave, as you are aware. This this is your P wave. Then, if in some people you get Q, in some leads here you can see one P, one Q. Then you get this R, then S. Then you get a T wave, and this is the ST segment. So the ST segment is the key segment that you need to look for to diagnose a patient having ischemia or infarction. So if this is beyond, this ST segment is below the baseline, then it is ST depression, and if it is above this segment, then it is called as ST elevation. So understood? I hope no doubts with respect to ST depression. So ST depression,
ECG. You can see here the 1 AVL V5 V6 will anatomically represent the lateral wall, and when there is changes in these leads, it will denote that the circumflex artery is having some issue. If the leads, that is the inferior lead, we call the 2, 3 and AVF, it is representing the inferior wall. You can see here 2, 3 AVF. In the 12 lead ECG, it is here, and this is the inferior wall. And if there is any ischemia or infarction, the changes would appear in these leads 2, 3 and AVF. And V1 and V2, and that would represent the right coronary artery. And V1, V2, you can see here, it is representing the septum, the ventricular septum comes here. So, and that is supplied by the left anterior descending artery. And V3, V4, again, when it comes down, this is the anterior wall of the left ventricle, and that is also supplied by the left anterior descending. So when you see any of these changes corresponding to these, you should know what artery could be the culprit and which is the area of the heart that is going to be affected. This is something very important when it comes to identifying ischemia or infarction. So also when it comes to the coronary circulation to the conduction system. You can see here the right